Technological acceleration is increasing exponentially. To make sense of this acceleration, we speak to scientists, business leaders, and policymakers on our new weekly podcast, The Interface. This podcast is hosted by John Xavier, the Hindu's technology editor, who will keep you informed about the dynamic technological landscape and the mindset needed to navigate this terrain. So tune in to The Interface on Spotify, Apple Podcast, or wherever you listen to your podcasts.
This is the In Focus podcast from The Hindu.
Hello and welcome to another episode of the Hindu's In Focus podcast. I'm Zubeda Hamid, your host for today. Last week on June 15th, the world marked Elder Abuse Awareness Day. How well are senior citizens in India doing? A report that was released by the NGO HelpAge India reveals that a large majority of them are not doing very well. The study, conducted across 20 cities in 10 states, surveying over 5,000 elderly citizens, found that nearly 65% reported that they were not financially secure. Over half of those surveyed suffered from 2 or more non-communicable diseases such as diabetes and hypertension, and at least 7% admitted to being victims of abuse. India's demography is changing. While senior citizens now constitute around 10% of the population, this number is expected to touch 20% by 2050. Family continues to play the role of primary caregiver, but also faces challenges physically and financially. What happens if the family is in another city or country? While India has launched programs such as the National Programme for the Healthcare of the Elderly and has enacted legislation like the Maintenance and Welfare of Parents and Senior Citizens Act, the implementation on the ground remains a problem. Are the current social security nets sufficient to take care of senior citizens? Does the health infrastructure need to focus on geriatric care? How can their financial challenges be addressed? And how can the country work towards providing comprehensive care for our elderly population? We delve into these issues with Anupama Datta, Head, Policy Research and Advocacy, HelpAge India. Welcome to the Hindu's In Focus podcast, Ms. Anupama Datta.
Thanks, Zubeda. It's good to be here.
Ma'am, let's begin with one of the facts that was highlighted in HelpAge India's report, which was about the missing middle. Senior citizens who do not fall under the ambit of government schemes, but also do not have enough financial resources for their later years. How does the situation play out for them? Does India have enough social security nets to take care of this big segment?
Yeah, Zubeda, this is a very, very important point that we have been trying to communicate to all stakeholders for a very long time. So, as an organization, our mandate is to focus on the poor elderly people. And like you know, that government has many schemes which directly focus, the needs of older people, whether it's in terms of healthcare or it's non-contributory pension, or you have other benefits. But for this segment of population, which is just above the poverty line, doesn't fall into any of these, doesn't get technically the benefit of these schemes that the government runs. So they are not entitled to claim non-contributory pension, which in most of the states is about 1,500 rupees per month, which is not enough, but is still some amount which is fairly good for an elderly person. So they're not entitled to that. Most of them have worked through their productive years. Women have either been housewives, so no savings at all. Men have almost always been in the physical labor part of it, so not highly skilled. So not the earning capacity even during the productive years is not very high. So they are unable to save for their old age. Second point that happens to them is that they're unable to continue to work, because that kind of work requires younger men, are preferred in the market. They get, it's better for an employer to find a younger person than an elderly person with all his frailties, maybe eyesight, maybe hearing, maybe ability to, do the hard physical labor. So they get sidelined and they get paid less. So even if they want to work, they're unable to get the amount that will ensure that they have a decent life. They're not entitled to any benefits from the government. So that makes their life very hard. And if you look at, because they are at the receiving end of the challenging work that they do during productive years, most of them end up with multiple diseases. And because the health system is such that it works from 9 to 5, so they are unable to access the health system, because if they do that, then they have to forego their daily wage, which they are unable to do. So their health suffers because they are unable to one, access public health system. Second, public health system as it is very, very challenged itself because of the capacity issues. It's already overburdened in certain respects. So if you do not have facilities, especially for the elderly people, then they have to stand in the same queue as any other person. And medicines, which constitute in NCDs, which constitute the major component of expenditure, that becomes very taxing for them. So we have had cases in our work experience, which we find that people suffering from NCDs are not taking medication as prescribed by the doctor because they themselves can't afford to buy, and they're unable to access it from the public system. So they are like, in a real fix. And the families that they come from are also not very well to do, because like I told you, that they have this low level equilibrium sort of thing in the family, that because they are unable to educate their children very highly, they also are in the same bracket of earning low wages. So they are also unable to, fulfill the requirements of the aging parents and also that of their children. So these people suffer the most, and women in these households suffer even more. And if they are widowed, they suffer the most. So these are the challenges of this segment of population, which is not in the focus of any socially minded scheme.
Would you say this constitutes a large segment of the population, of the geriatric population?
Yeah, if you look at our labor force, only 9 to 10% is in the organized sector. So if you take out that 9 to 10%, they are like people who are earning well and are able to continue to work. They may be CAs, bankers, or teachers, or professors, or lawyers, or what have you. So they're endowed people, they can continue to work, and even during productive years, they earn enough. Most of them have, if they have retired from government service, they have what is called a good pension system, which they can fall back on. They also are more endowed in terms of, savings and investments. You have a 30%, almost 20 to 30% of the population below poverty line. They are at least getting government benefits. So what happens to this approximately 60% of the missing middle? And that's why we are calling them missing middle, because they are missing from the perspective of anybody. Market is unable to service their requirements because they do not have a demand. They only have a need. Government is unable to provide them any benefit because government has a targeted approach for the last mile. So that's where the challenge lies. And family, like I told you, does not have enough to support them, and they themselves have limited capacities to continue to earn. So that is a very big challenge. And that's if you look at NPS Lite, that's in some way trying to address this sort of challenge. But we all know that NPS Lite has not been able to attract the contribution from most of these people.
Let's talk a little bit about what you mentioned a little earlier. One of the problems of the overburdened healthcare system, especially for geriatric services. So we know that the central government brought out the national program for healthcare of the elderly. We have the Ayushman Bharat PMJ scheme, where primary healthcare services are supposed to be provided, as well as an insurance package for secondary and tertiary healthcare services. How well are the senior citizens in the country covered? One, under the national program for healthcare of the elderly, as well as health insurance policies. What more can be done for geriatric healthcare in the country? Is this an area that we really need to focus on?
Yeah, see, health is the most critical area, if you ask me, because if you're in good health, you're self-dependent. Second, you do not have to spend on treatment and management. So there are two benefits of good health, which most people do not have as they're aging in this particular segment of population, because they have nutritional deficiencies, they have lack of access, their health-seeking behavior is different. So they have these three disadvantages to take care of. And because they're not able to contribute financially to the household, their nutritional needs are generally overlooked. So that's a very big challenge. The other part is that if they have NCDs, which the national data shows that at least 23% of the elderly population has at least two NCDs, mainly diabetes and hypertension. So if that is the case, then they have to undergo treatment, and treatment requires tests, and it requires continuous medication, and it requires continuous consultation. Apart from that, they have the national data shows that they also have the problem of mobility, because the limbs get affected. So if limbs are getting affected, then they require either physiotherapy, or they require some kind of physical exercise to happen all the time, so that their limbs, the musculoskeletal system is healthy. And like I said, that most of them are into physical labor, so that gets impacted. And if nobody is taking care of those systems, then it impacts their abilities all through. It also makes them dependent on the family for the ADLs and IADLs. So health is crucial. Health is very important. So preventive health is not a conscious part of our healthcare system. No programs in India which talk about healthcare, preventive healthcare systems. So it's completely in the private domain of the individual and the family. If the individual and the family are able to, prevent health things from happening, then they can. Otherwise, there is no public health initiative that drives you towards this, or good behavior as we call it, or good aging as we call it, or active and healthy aging as we call it. So that is one big challenge. When you come to curative healthcare, you have a public health system, and most of the data, whether it's the government data or the data collected by other independent researchers, it shows that heavy dependence on public facilities for healthcare access. Most of the elderly, and as the age increases, most of them are dependent on public health facilities. Now, public health facilities, and because I said that they suffer from NCDs, they do not suffer from general diseases like, cough or a cold or whatever else you have. So they require tertiary care. And tertiary care is generally available only in the CHCs or in the district hospitals. It's not available in PHC. So they need referrals. And that becomes an access challenge for people who are living in rural areas and faraway areas. And it also becomes, health seeking gets impacted. Like I was saying, that women who are alone, women who are widowed or living alone, or those who are living with family but dependent on the family, their access gets impacted by it because the facility is far away from their home. They require money to travel to that place, and health system, like I don't know if you're aware of it, that it requires multiple trips to that facility.
Yes,
you will get
that's
consultation
right.
one day, you will test one day. So that is costing money to the family, plus that is also costing manpower support, because the lady probably cannot go alone. So she needs somebody from the family, which is not possible in this case. So their access becomes very difficult. So normally, sometimes you must have heard people say that, it's old age problem. So don't worry too much about it. Don't over medicalize it. So they do not access these healthcare facilities, and health deteriorates and suffers, and they do not even know. So we have a lot of cases of undiagnosed, NCDs in elderly people. So health and Ayushman Bharat. Ayushman Bharat is a very good scheme. In our recent report that we just released on 14th of June, we found that 2/3 of the people who had any kind of health insurance were in the PMJY. But the challenge again remains that they are again using the same facilities that are overburdened. And if in these overburdened facilities you do not have a special, focus on geriatric population, then their access becomes a challenge in the real life. How do they access these facilities? How do they make use of these facilities? What is the attention the doctor can give them? Can they really stand in the queues? Can they really wait for those tests to happen 3 months, 4 months? And then second, what are the facilities available? Are these facilities appropriate to the geriatric population, or are these just general facilities? That's also very important. So NPHC is very important in this context of general architecture of the system and access to the system. Now, if you have an NPHC system, for example, which is functional in most of the states, it has its own challenges, but it's still better than having nothing at all. And I think wherever we have it, like, it starts from it is at all levels. It starts at PHC level, CHC level, and then it goes up to the tertiary level. So we do have, sanctioned facilities available. Then you have facilities like indoor wards, you have OPDs, you have physiotherapy services, you have lab services. It's available. It's supposed to be available to the elderly people, even at the PHC level. And you have about sanctioned capacity is 18,651 as per the report of the ministry in 21-22. So these are facilities that are available, but the challenge with this particular system, you have also regional centers, 16 regional centers which are working, regional geriatric centers which are working in those very high-level tertiary hospitals. You have facilities available, special facilities available in places like AIIMS Delhi and Chennai. You have special wards with indoor with admission capacity or the bed capacity of 400 to 600 people. But the thing is, how many can access them? That is one. Like, how many can go to Delhi AIIMS? That is one. How many can go to Chennai AIIMS? That's one. And look at the population that is going to access these facilities. And do we really want to put the burden on the tertiary, or do we want to screen it from the lower levels? So the architecture of the system has to be very careful about that fact, that we want everybody to go to the tertiary hospital, or do we want to have facilities at PHC level, which is the most easily accessible for an elderly person, and screen them there and provide them specialized services there, like you're providing maternal and child health at primary level. So isn't it desirable to have that kind of parallel system at primary level and focus system? Because, like we always say this, that the proportion of population that you will service is really high, and it's going to be higher in the next couple of decades. So if you do not change the architecture of the system, we will end up with a lot of burden on the facilities that probably they'll not be able to take care of it. Second part about the National Program for Healthcare of Elders, it is within the domain of the state governments, and we are told that it is something. It falls the money part of it falls into what is called the flexi pool. So it is the discretion of the state government how much money they want to allocate under the National Health Mission to this particular facility. Now, we all know that elderly are not the immediate priority of any state government, most of the state governments, leaving aside states like, southern states, where population pressures are really high. In North Indian states, because the population is still very young, the median age is still 29. So we are still dealing with the challenges of the youth and the children and what have you. And in this, another point that I would like to make here is that women are a very important segment of this aging population. And for women, we already have services in place. We are looking at young girls, we are looking at adolescent girls, we are looking at young women, we are looking at their, at least reproductive health. So if we have a channel, why do we stop at 50? Why can't we take that channel a little further and also include aging women into that? It's not that difficult, but we have not thought about it. We are still treating elderly women as a separate segment and not creating any special services for them, which is very essential if you ask me.
That's a very interesting point. The fact that we have services for women and children, but we are not extending it beyond the age of 50. Moving on to one of the things you pointed out, ma'am, the fact that while we don't have enough services for the elderly, the fact is that India is going to see a shift in demographics. The elderly population is by 2050 is expected to touch 20% of the entire population. One aspect I'd like to focus on is the caregiver aspect. Could you talk to us about this? Because in India, as we know, this role primarily falls to women in the family. How well equipped are caregivers? Is caregiver burnout a problem that you are seeing in your work experience?
Yeah, this is also one very important aspect of aging in India. We did a survey report in 2018 where when we talked about elder abuse, he also spoke to the family, because if in India still majority of the people, elderly people, are living with the family of the young adult children. It's not that they're living alone. Living alone population is increasing, but not at a very rapid pace. So family still continues to be the main caregiver. Now the challenge here is longevity and changing nature of the family. Longevity meaning that now elderly are living much longer than what they used to live 20 years ago. If you're 60 today and you're a woman, you're likely to live another 18 years. On an average, you may live more. So the care burden falls on this lady, who is the lady of the house, the younger woman. And when we were doing this survey that I mentioned, we found that the women mostly took care of the ADLs of feeding, bathing, that kind of work, and the men only shared the burden when it came to taking the elderly people to the doctor or outside or for recreation or whatever else. So the involvement of the men was of a different nature than the women. This is one aspect of care. So elderly women, and many of them, they were though they said that they like to work for the elderly people and they were very emotional about it, but some did say that it becomes difficult at times because I'm the only one and nobody wants to share that burden with me. And I'm, for a reason, morality, respect, not trying to hurt anyone, I'm unable to even express this fact to anyone. So the women in the younger age group are facing this challenge that nobody shares the burden with them, or responsibility as we call it. So they say that if I have taken the responsibility, nobody in the family or the extended family wants to share it with me. So I have to, if once I have taken it, I have to continue to do this, whether I like it or not. And then second is that there's no respite care facilities available. There is no place that you have institutional care systems, or the other informal care systems are not that strong here. So if supposing the young caregiver wants to go out for a week just to de-stress herself, there is nobody she can fall back on to to take care of the elderly person when she's not done. And those mechanisms go a long way in the quality of care that is being offered to the elderly. That is one. Second aspect of women in care is that these women will eventually grow older, and when they need the care most, they may not have anybody providing that care to them, because elderly women living alone or living only with spouse, with children living abroad or living in other cities, unable to take them with the younger people. This is the major challenge, that elderly women living alone and nobody caring for them. And during COVID, it became very evident for us because we were running this helpline, and many elderly, well-to-do women, whose children were living abroad or whatever, or even in India in different cities, because of lockdown, they could not provide that kind of support that they could. And these people, women living alone, one thing they got very scared that I'm alone. There's nobody. Even if I need help, nobody can rush to me for help. That was one. So psychologically, it impacted them. And second, that they were not tech savvy enough to access these services through the apps that were developed or were available. So that became a major challenge for them. Third aspect that during COVID we found was that elderly caregivers taking care of super elderly parents or parents-in-law, whatever relatives. If you have employed a caregiver from outside, and because of lockdown that caregiver can't come and is becoming a challenge itself, then how does this elderly take care of a super elderly? That became a major challenge, especially in urban areas. Rural areas, it was little different because there the social dynamics are a bit different, but urban areas across the country, whether it's big cities or not so big cities, this was a major challenge. That how do you access services? Then third point in care is, of course, paid caregivers. For bedridden elderly, sometimes you require a trained caregiver. So trained caregivers cost a lot of money, which many families are unable to afford, even well-to-do families are unable to afford. And if the elderly doesn't have any resources at all, is completely dependent on family, then it becomes even more challenging. Fourth point is that trained caregivers, like you said. So if people with dementia and Alzheimer's, people with other kind of diseases where they require health interventions, that itself is that's a complete gap. Like trained caregivers is a big challenge. Big challenge. One, of course, there are not enough trained caregivers. Second, even if they are available, we do not know the quality of service because it is completely unregulated. We really do not know. And of course, like I said, it costs a lot of money. So caregiving in institutional settings has its own challenges. And most important challenge is that can I leave my 80 years old mother with a stranger? That's also a big challenge. It's just like your children. Can you leave your children with a stranger? But can you still, like, it's a stranger being introduced into a care system in a family that has its own challenges.
That's correct, ma'am. Let's move on to one of the other findings of your report. The Maintenance and Welfare of Parents and Senior Citizens Act. One of the findings that you brought out in your survey was that there continues to be very little awareness about this act. Tell us a little bit about how easy is it for senior citizens to apply for maintenance under the act? Are there implementation challenges on the ground that need to be fixed?
This is an old fallacy we have that social problems can be tackled with legislation. We have had this fallacy for a long time. But in this particular case, this legislation, this model legislation was passed in 2009 by the Central Parliament. It took good 10 to 12 years for all states to notify it in their states and then adopt the other procedures required for real implementation. There were 5 steps required for it. They had to appoint tribunals, they had to appoint appellate tribunals, they had to all other things, which was, they were not, that progress was very, very slow, very, very slow. So it took good more than 10 to 12 years for all states to notify and take the steps. One part of the challenge. Second part of the challenge is that elderly people knowing about it, though the legislation claims that, that's the whole point. Why do we have this special legislation? Because it's an enabling legislation. It allows you procedural, it eases the process actually. Now you do not have to go to a court. We had the Maintenance Act earlier also for parents, adoption and maintenance of parents. We had that act, but that act was only to be implemented by the courts. You had to approach a court to get that thing implemented. This particular legislation said that if you go to the tribunal, which is set up in the district collector's office or the SDM's office, you can do it. You don't have to do any legal things. You just have to give an application. So it was easing the process. It made the process much better than what it was under the typical legal system. And the tribunal had enough powers of a court, so they could manage these cases. Second was they had the power to call the children to the court, and there was a time limit during which they had to deal with this case. It was all the, if you look at the procedural part of it, it's making it very easy. But the challenge is that how many SDMs have the time and the inclination to deal with these cases on priority. These are family related cases. They're not very easy to manage. So how many of them have that? So the law said that social welfare department should be given a good part of it, because reconciliation is also a process that should be tried. But reconciliation, we found that in real life, reconciliation was not happening as much as it should have happened. It became an adversarial sort of thing. So that became a challenge. And the other part from the demand side was that how many elderly would go take their children to the tribunal. That also became a big challenge. They had mental blocks, and if supposing the elderly was completely dependent on the family, then could they really take the chance of, if they were physically dependent, could they take a chance of going to the tribunal and saying that they're not taking care of me? They would rather use the informal, family and the extended family systems to put pressure on the children. So that became a major challenge. And awareness, of course, like I said. And this act does not have only the maintenance part, it also has, it puts obligation on the government also to run old age homes, to run a health system which is geared to the geriatric population. So, and the act itself, it's so progressive that it has inbuilt, mechanisms to create awareness at mass level. But those things didn't happen as much as they should have happened. The highlight has somehow come to be on the maintenance, which is claimed from the family. So those are the challenges this act is facing.
Moving on to another part, ma'am. The Niti Aayog paper on senior care reforms in India pointed to the need for a paradigm shift. That is what they said, to achieve comprehensive senior care. They said there has to be more coordination between the ministries of health, social justice, finance, etc. How do you see this working? Is this something that should be considered? Is this something, for instance, that other countries have done to achieve, other countries with aging populations, to achieve senior care, to achieve comprehensive care for senior citizens?
See, it's a noble idea. It's a noble idea. Coordination and not new. To look at the central structure, the Ministry of Social Justice and Empowerment is the nodal ministry which has the responsibility of coordinating other ministries which are dealing with aging issues. That is anyway the structure. But the real challenge is that in this hierarchy of ministries, what is the status of this particular ministry which is dealing with it? This ministry is dealing with SC/ST. This is dealing with social defense. This is dealing with disability. So the ministry itself is like, it has many other things that it is looking after. So lot of these senior citizens associations have put forth this demand to the government time and time again that we should have a separate ministry for this segment of population, which is soon going to be 20%. So that is one challenge. Other challenge is that at central level, if you look at the subjects that impact the lives of elderly, they're falling within the ambit of the state government. So central government at the most can make a model thing. Like this NPHC is also a model thing. Legislation is a model legislation. So there's very little that the central government can do in this. It's basically the act has to happen at the state level. So unless the state notifies the act, it doesn't come into play. Unless they adopt the NPHC and put it in, start the wheel rolling, nothing happens. So it is the real action lies at state and the district level. So central ministry can make a there was this review of national policy of older people, and a lot of state governments said that money, you can give me a model thing, but where is the money? And if the central government is not allocating money, then why are they telling me what? If I have to raise my own money, then I have my own priorities. So that is why, if you ask me from the government's point of view, the action is at the state and the sub-state level. So if, for example, in many cases, many state governments, we found that the legislation was notified, but the rules were not made. But many district collectors went ahead and said that, okay, we can entertain cases under this act because the act itself has, a fairly good amount of detail about how to handle it. So they did not wait for the state government to make the rules and then start implementing it. But that's a thing which is a discretionary thing. If you have a person, if you have an SDM who is wanting to do action, he or she will do. But it is not a systemic response to a challenge which is very, very systemic. So I think that the challenge here is, if you want to provide good care and everything, then it has to come from the state level and the sub-state level. So district is very important. And if you look at the advanced countries who have very developed long care systems, there the community systems and the district systems have a big role to play, because that's where the response will come from. Old age home cannot be built by central government, but it has to be built by the district, in the district somewhere, which is a place which is accessible, which has all the other facilities and what.
Thank you so much for speaking to us today, ma'am.
Pleasure.
In Focus will be back soon with analysis of the biggest news issues. In the meantime, you can find our podcast on Spotify, Apple Podcasts, Stitcher, and other platforms. Just search for In Focus by The Hindu. We'll see you soon.